Greetings to all. It is my pleasure to welcome you to this last session on the in the conference, the closing session of the first Innovation Forum in the Western Pacific region. To those who have joined us in previous sessions, I welcome you again, and I hope you find this one as inspiring and maybe even more so than the others. And to those newcomers who have not been with us, we have new voices and fresh minds are always welcome. We look forward to your comments in the chat and the questions. I am Gordon Galia, WHO representative in China. But in the innovation role, in the Innovation Forum, my role is as the co-lead for the innovation work across the region. And I will be your moderator for this session. I ask the team to share the slide where we have a few short housekeeping points to make. As for the previous session, this one, which is called Getting to the Future We Need, we would like to invite you to participate in an exchange of ideas on the subject. In order to promote good behavior, we would like that everyone be logged in with your full name so that we can identify whom you are, to refrain from marketing of products or services or taking the political positions that are counterproductive to to having a good discussion that is open and collaborative. We will exert this this policy in case of bad behavior. We will be removing people. Next slide. So, to those who are on Zoom with us, as well as to those who are listening in on YouTube, I would like to remind us that throughout this conference, we have been talking about innovation under the tagline of rethinking, researching, and redesigning. Three processes that take us to through a process of accelerated and continuous learning. And these keywords have served as our signposts in the journey towards innovation and public health. In this closing session, we will be taking a less formal and a more personal approach. And we would like to run this as a fireside chat, not so much as in the previous series of presentations. We will be doing this more as a discussion with well-known and very well-renowned innovators and public health leaders who have been throughout their career contributing in a very global and public fashion to thinking about the way we define and value health, the way we measure health, the way we research, publish, and advocate for health, both within and across countries, and the way we develop and deliver solutions in public health. So we will hear from them what they believe innovation looks like in public health, especially in this era of the pandemic and beyond. And we will hear about it from their own personal perspective, asking them as much about their beliefs and values in innovation as about their professional positions and practice. We had originally looked to start with Samira Azma, but I do not see her online. So if you don't mind, Richard, I'm going to go straight to you. Sorry for, the introduction of the people on this panel is a bit problematic for me. It almost feels like I have to say, if you don't know our speakers, Maybe you came to the wrong Zoom webinar.
Don't say anything.
I
Don't
would
say
like
anything.
to.
Don't say anything.
Okay, okay. Richard, you have redefined the role of what it is to be an editor for a medical journal. And I'm going to take, I'm going to ask my colleagues to stop sharing because I'm going to introduce you in a different way. I'm going to bring this online. And this is just a listing, which will be very familiar to you, Richard, a listing of the last 100, the last 100 articles that you have written in the offline blog of the Lancet. I don't know whether this is an act of pride or now whether you're embarrassed by it, but it is a great illustration of the range of subjects that you have been discussing only very recently. And my most recent, you have most recently impressed me with the book that you wrote about the COVID catastrophe. I think with the rest of the world, all those who have read it. In it, you have, in a way, done what we've been talking about throughout the innovation meeting, and that is that developing a future vision, the place we will have to get to. And my question is very much about what are your thoughts about the innovations that we might need in the political, social, or other spheres in order to achieve this vision. I just highlight a few of the words that you wrote, that COVID-19 is not an event, it has defined the beginning of a new epoch, that we surely have to use this occasion to resist and challenge past estrangement and prejudice, that we have to use this time for solidarity, for mutual respect and mutual concern, that the post-COVID-19 age will usher in a new era of social and political relations in which our liberties will be achieved through new means of cooperation and communication. And that finally, COVID-19 shows us the importance we should attach to our global identity. We are social beings, we are political beings. COVID-19 has taught us that we are mutual beings too. I cannot read those words without being moved. Beyond moved, how do we go forward, do you think, in innovating towards that splendid future?
Well, again, thank you so much. It's extraordinarily kind of you to invite me to join you on this panel. And I just want to give a few reflections on this idea of innovation. And thank you for framing it the way you have. First of all, as we're approaching 1 million deaths, the figure on the WHO website last night when I looked was 931,321 deaths from coronavirus. So probably sometime towards October, in October, we will reach the 1 million death mark. But despite that, I actually want to strike an optimistic note, which may seem paradoxical given the times that we're living in. But the reason why I want to be optimistic is actually history. Because if you look at the history of pandemics, really since the Black Death in the 14th century, we can be confident about the aftermath of this particular pandemic. This pandemic is going to change societies throughout the world. It will erase one society and give birth to another society. Out of the tragedy of this pandemic will come new societal beginnings. This pandemic will change governments. Governments will, they already have, begun to learn the lessons of the pandemic. And this pandemic will change publics throughout the world who will demand and desire safer, healthier conditions for themselves and their families. Those at the margins of society, those who are often invisible and unheard, will move to the political center stage. Indeed, after the 1918 pandemic of influenza, there was an acceleration in the pace of political and social change that laid the path for universal health coverage, public health reforms, a war on poor housing, artistic renewal, and indeed the conditions for global regeneration and multilateralism. So how do we get to that optimistic place? First, we need to emphasize the importance of a renaissance in multilateralism. A global emergency such as this coronavirus pandemic demands a global response. COVID-19 in one way brought the world together, but as we have seen, divided it still further. It set nation against nation, president against president, people against people. But we must reaffirm, despite the skepticism, despite cynicism, despite what some people might say, we must reaffirm that the United Nations must be at the heart of this renaissance. And it must take a risk. The organization that is the United Nations must take a risk. There is a device that the United Nations possesses called an emergency special session of the United Nations Security Council that can be invoked when there is a threat to international peace and security. And indeed, I think we can all agree that this pandemic is a threat to international peace and security. If one calls an emergency special session of the UN Security Council, the goal of that meeting would be to build solidarity between nations, to enhance coordination to control the pandemic. Parenthetically, I will note that I find it extraordinary that 8 to 9 months into this pandemic, there has still not been any global gathering to coordinate a global response to the pandemic. And an emergency special session should be convened to share knowledge and to begin to learn lessons and share those lessons between nations. Now, such a session can be called in one of two ways: a simple majority of member states, or 7 members of the 15-member Security Council. On the Security Council, you are aware that there's a permanent 5, China, France, the Russian Federation, the United Kingdom, and the United States, and 10 non-permanent members, including at the moment, Germany, Indonesia, South Africa, Vietnam, Belgium. Now, many of these countries have been either very, very badly affected by this pandemic, or indeed would be considered exemplars in their response to the pandemic, and so have many important lessons to share. Only 7 of those members are needed to call an emergency special session. It could kickstart a process to reconstruct amity and cooperation between nations to confront the greatest threat that we've had in recent generations. Now, a second innovation is this, and what I've just talked about is a very top-down process, but we also need a grassroots movement. And health workers throughout the world have been on the front lines of this pandemic, risking their lives in exceptionally vulnerable settings. And we owe a debt of gratitude to health workers worldwide for what they have done. There are well over 40 million health workers in the world today, about 10 million doctors, 20 million nurses and midwives, and 13 million other cadres of health worker. And I think we need a global alliance of health workers who have shared the same experiences these past 8 months. They've been shoulder to shoulder in every community, in every country, and across every continent. An alliance of health workers to fight the factors that have left our planet vulnerable to this pandemic, by which I mean inequality, social exclusion, those living with chronic disease, those unable to get social care, gender inequality. Do not forget the shadow pandemic of women and children at risk of domestic violence, racial injustice, and poverty. A third innovation, we need a short to medium term trigger for enhanced international cooperation and civil society action. Now, what might that trigger be? We need something that we can, something very concrete that we can use to galvanize national leaders to create that emergency special session, and something we can galvanize civil society to respond to. And I think the trigger is this: the need for a fair and equitably available access to a vaccine to protect populations from both the infection and severe disease. A vaccine is a tangible entity that can be an instrument to galvanize political leaders and a grassroots movement. But right now we are seeing vaccine nationalism erode possibilities for vulnerable groups to be prioritized for access to a vaccine. But we have one very important innovation that we need to prize carefully. Through the efforts of the World Health Organization, the Gavi Alliance, and CEPI, they came together to create COVAX, a unique global collaboration between now 170 countries to ensure that people all over the world can get access to a vaccine irrespective of how wealthy they are. COVAX is a very important innovation that can be the catalyst for a different way of doing business between nations. So to conclude, it is true, and we should be frank about this, there is much to regret in the way that governments and global institutions have responded to the pandemic. COVID-19 has tested our global solidarity, it's tested our resilience, and in many places it's found it wanting. But COVID-19 is not our destiny. And I want to return to that note of optimism, because through our common values, our inherent human ingenuity, and our shared desire for a different future after this pandemic, which we will all share, and our willingness to ask and answer a question at the center of this pandemic, namely, what do we all owe to one another? I believe that these three innovations and their success could create the conditions for a new era of global renewal and regeneration. Back to you, Gavin. Thank you.
Thank you so much, Richard. I think you embody the three keywords of the conference: rethink, redesign, research. Your journal has published a lot of the seminal research that lies behind our knowledge on COVID. The ability to imagine an optimistic scenario for the future is the epitome at this point of rethinking and the redesign of the three innovations that you have mentioned. And as Alona has said, the global, in the chat, the Global Preparedness Monitoring Board has actually called for a special global summit on health security for next year. But it is amazing how many of the innovations that we see as being very obvious are actually the ones that are most elusive. In the digital health session just before, a lot of the time was spent on discussing how and why we don't have data interoperability decades after computers started to come into the health system. And so the obvious innovation is not necessarily the one that is easiest to attain.
Exactly.
Samira, they tell me you were online earlier. I will switch to you if I may, and apologies for skipping you. Apologies for that.
Not a problem, Gowden. Thank you. I'm online.
Welcome. All three of you, Richard and Ilona, are there abominably early in the morning. Samira Azma is Assistant Director General for Data Analytics and Delivery in WHO. I also know Samira as a personal friend from a long time back when we were both working in tobacco control. And it is interesting that for those of us in the field at the time, we felt like we were recommending innovations, policies such as cessation or taxation that at the time were criticized as lacking in evidence and challenged for their efficacy. These are policies that are now enshrined in the WHO FCTC alongside the international health regulations. Is now one of the most successful international treaties. But many years later, we still face the challenge. And now you face it in a different way. Samira, as Assistant Director General for Data Analytics and Delivery, it is your task to make that bridge between data and policy. And to do this in a way that both advances our attainment of the Sustainable Development Goals, as well as documents and the attributability of the impacts of WHO's own work. So, for your own journey, what are the lessons that you would share, and what lessons would you impart to the countries and members and territories of the Western Pacific region? What lessons in innovation would you share with us? Over to you, Samira.
Thank you, Gowden, and thanks to Wipro for having me over, and hello to all the panelists. Richard, very good to see you, and thank you for your inspiring words and the book that you wrote, very timely. Gowden, you have an excellent memory, as well as the way you have given the analogy of bringing tobacco pandemic as well as COVID. There are parallels, and I just want to say I represent the division of data analytics and delivery for impact. And as you know, that with WHO's first transformation ever in its 70 years of history, Dr. Tedros had the vision to make the organization, again, very data-driven, and to prioritize that data should be cross-cutting, and every action we take should be driven by evidence. We have also seen how we have been spiraled out of making an impact during this pandemic because of lack of data. Even today, we don't have a very good count of number of people affected, tested, recovered, or a fact which is deaths. We don't have a very good handle on that. And this is a symptom of countries' capacities and our inability to have invested in strong health systems as well as health information systems. So there are lessons to be learned from tobacco control. Late 90s, during the master settlement agreement that happened in the United States, took the tobacco industry on, and Joe Camel, which was a very familiar cartoon, Marlboro Man, which was very well-recognized brand globally, was shut down, but it required that global solidarity. WHO activated its power to bring all the nations together and launched into the negotiations of the first ever public health treaty, the Framework Convention on Tobacco Control. And it took several years from late 1990s onwards to realize the power of United Nations and the international treaty making, similar to the international health regulations. Treaties should have teeth so that it is driven by accountability and data that is timely, reliable, and actionable, as well as shared in a transparent manner. And it becomes more important in the cases of emergencies and cross-border, similar to tobacco control. We ought to know how the trade is happening and who's smoking, who's quitting, and who's dying due to tobacco, still being the leading cause of preventable deaths globally. But we had good successes. At that time, there was no data. We were challenged. And in 2000, given that we started bringing the evidence from the youth tobacco surveys in the United States, and that led to activism because there was data and the industry was targeting underage youth and children. We took the lessons from a country and applied it globally. And the first 12 countries that championed were the low and middle income countries that did not have data, and primarily many came from Africa. There was lack of data, we did not know. That led to the launch of the first standardized protocol to gather data on tobacco use and tobacco control policies, called the Global Youth Tobacco Survey. The whole African subcontinent spearheaded in the negotiations to drive the various protocols of the treaty-making process, from bans on advertising, promotion, and marketing, to increasing taxes to generate revenues, to prevent smoking or tobacco use, as well as many other protocols, including the recent one about cross-border smuggling. But the whole origin was to have data that led to the various streams from led to activism, led to outrage, led to countries going forward and introducing policies that were already much ahead of the treaty-making process. Australia, Canada were the first countries using the data to go with plain packaging. Countries like Thailand, Nepal, Switzerland, and many others started using the taxes from tobacco and introduced the health promotion or other ways. And as recently, Philippines used the tax revenues from alcohol and tobacco and has funded the universal health coverage. So it can be done. The data gaps that we see can be fixed. And today, global tobacco surveillance system is one of the largest tobacco surveillance system that has, or any surveillance system that has ever been established and maintained. It's not only for youth anymore, it is also for adults. And many countries are making, continuing to repeat the survey so we can see change over time within countries, as well as comparison across countries. And that is, again, to have a very systematic, standardized approach to data collection, data curation, communication, and most importantly, using data to advance and drive and deliver policy for impact. The division of data analytics, the way we are trying to work is reduce the fragmentation that we are seeing, deriving the lessons that we have taken from tobacco and other ways of data that has been collected efficiently. And now the innovations, the technology at our disposal will help us accelerate and leapfrog. There are many ways to gather: crowdsourcing, artificial intelligence, machine learning, but building that capacity, the core capacity in the country in a sustainable manner. I think what will be needed, and again, as Richard mentioned, nations coming together and evaluating and reviewing where we are and why were we not prepared, and why are we taking a while to address and mitigate, come out of this pandemic.
Thank you so much, Samira. And I knew there were parallels, but I love the way you drew them out, in the way that focusing on one issue, COVID, could make us forget how common these issues are for the different pandemics, going back to AIDS at its beginning, or tobacco. How important it is to have activism, how important it is to have the data to bolster those arguments, how important it is to identify the vested interests and to work for what we have called, in Richard's words, amity and cooperation between countries. No health without data, no health, if I may paraphrase an old saying, no health if not global health. And no, we are not here fetishizing the word, Richard. I think that this is very appropriate and very much in context. Thank you to Samira. I'll move on to Inwo. Inwo, I'm very glad to see that you are able to make it. You are the farthest in time zone. You are currently based in the United States, but you are senior advisor to the Bill and Melinda Gates Foundation. If there is such a thing as a Renaissance woman, you embody it. You have achievements in many different fields. You are a scientist by nature, by original training, a management consultant for much of your working career, a blogger with 1 million followers, an influencer in the modern era of social media, a founder of an innovative school that fuses the educational systems of two cultures. Somehow you embody what we essentially need in a process of continuous innovation, which is a process of connection and the ability to draw multiple disciplines, multiple sectors, multiple stakeholders, dare I say, multiple ideas together. So our question to you, what are the practical lessons and recommendations that you would share with practitioners, such as in our audience and in the countries and territories of the Western Pacific, who also have to share and straddle multiple sectors and disciplines to solve public health problems? Over to you.
Thank you, Gordon. And it's a great pleasure to be able to share some thinking on this. It's actually very humbly listening to both Richard and Samira talking about these experiences. And I think probably I'll take advantage of your introduction of me. Now I've recently stepped down as the China director, so I can take a little bit of the outsider sort of view in thinking about these issues. I think probably one thing I have benefited from, and I think I've sort of brought into different roles I play, is indeed this outsider view. So I think oftentimes when we are deep in the organization, we actually think very much, as a image, we portray ourselves, either the organization or our role. And that oftentimes actually stifle our, potential innovation and thinking. So I think I've been always trying to be sort of the outsider and then sort of live on the margin, so to speak, And it's difficult because especially when you're deeply enrolled, it's difficult to do that. But oftentimes hearing from other people what their real sort of feedback or view on your organization is sobering, because oftentimes they're not so complimentary as you have hoped. But I would consider ourselves fortunate to be able to hear in that. So I think having this outsider view is actually quite important, especially when we are actually deep in a large institution organization. I think that's one. And second, I think is probably really this point about connections. In a way, I think frankly, of course, everybody, here, Gordon as well is a dear friend of mine. I think we all share, Richard mentioned that as well, as the optimism. But frankly, if you think about today's world, I think there is so much to be worried about. And I am deeply, deeply worried of where we're heading. I think on the one hand, yes, we have all the, seemingly platforms, multilateral platforms, the United Nations, WHO, companies, the different mechanisms we are forming. But on the other hand, there is also massive underlining disruptive forces as well, right? And I think what this COVID has revealed, if we take ourselves off the head of health professionals, is this deep fear, as almost like animal-like fear. So it's very, very rudimentary, but the fear is exhibited in different ways, right? So sometimes it's conflict, sometimes it's territorialism, sometimes it's mistrust and all that, but you actually see the fears bubbling up in all different connections. And so like, in a way, how do we really address it, when we take ourselves outside of the institutional view? I mean, don't be offended, but like, I would ask, how many people actually read Lancet? Of course, I mean, this is not my personal view. Of course, we know how important that is. But seriously, if you go on, what young people are reading, what information are people digesting? What are they discussing? Very few. Like, how many people log on to WHO website to check on data? Frankly, I can confidently say it's a small fraction of the general population, right? And then what are, how do we think about making that connection work? Because oftentimes we can feel good about ourselves. I'm really speaking for myself, because oftentimes, we're super busy, we work really hard. What else do you ask? But sometimes when you look outside, you will realize, hey, sometimes we seem to be in our own bubble. Not our own fault, but I think, that challenge becomes so massive that, almost require everybody to think from that angle and see what's really shaping that public opinion, what platforms people are using, and why certain fears are being bubbled up without the right, positive engagement. And I think partially, to be very frank, I think that exhibit the level of fear each one of us have as well. I certainly have. So like how, so at the end of the day, it's almost beyond sort of institutional thinking. It gets to the very personal level, right? How do we, I think Richard talked about this mutual beings. That's very true. But how does that exhibit ourselves in the way we operate? I think that's really kind of having that connection to sort of the layman's view. I think it's very important. And oftentimes, especially for us, probably with scientific training, we have this a little bit of, I certainly do, I probably speak for myself, the intellectual arrogance, right? And saying, hey, all the data is there and the research is done, the paper is out. But this is only the very, very beginning. I think that kind of thinking that connection is very important at the broader sense of innovation in today's world. I think the last point I want to share is really around this sort of asking dumb questions. I think many of you probably are parents. I have 3 young children. My oldest is 10. And oftentimes I feel, like loss of words to respond to their questions. But oftentimes I feel fortunate, like I can get, confronted with these questions. I think, of course, you can, frame it in a more fundamental way as, okay, this is first principle thinking, going to the roots. But I think asking those questions are important, right? So like, why are things not working, right? Like, you know, like, yes, everything was framed in you know, when the narrative comes out, of course, we all try to rationalize it, and that's how we function, both as human being or as scientists. But why is it failing? Like, why things are not working? Why all this, you know, the positive narratives are not picking up? And then I think those type of questions, kind of almost the childlike view, is something that really will benefit us in thinking some of the issues and challenges. And I would actually almost end on a bit of a pessimistic note. You know, oftentimes I was discussing with my friend, and you're looking at what's happening now, right? Of course, you know, I'm on the west coast of the US. There's massive fire. The AQI is in the 500s. And, you know, like the whole climate change is real. And oftentimes I think, what are we leaving to the generation, like, you know, like to our kids' generation? And my friend shared that his daughter is 15 years old. And he basically said that the daughter basically says, you know, to her dad, that your generation should be so shameful, feel so ashamed, like what you have failed to do. And of course you feel offended. I feel offended, but that's true, right? I mean, so like, if you think about it, I think somehow we have cursed through things, almost there's a certain inertia we have had collectively that has led us to this place. And I don't think we're getting better. On surface, yes, we're doing all the things we can, but is it really enough in curbing what's happening? On a personal level, I don't think so. And so like, then in that sense of pessimism, I mean, it's not a thing we're giving up, but I think that's really what's important, you know, in the child's eye, thinking like our generation should be, you know, feel ashamed, and I do. And what does it mean for us what to do? Like what, you know, can we be more audacious? Can we be a bit more, you know, like bold in thinking the approach we're taking? Is it really enough? And I think, no, I don't think it's enough. But what else needed to happen, right? Both at the institutional level, at personal level. I think that's a question all of us who think about innovation should really think about. And that's the fundamental level of innovation that really matters. But again, I'm saying that doesn't mean I have a solution, but those are the questions I think we probably should all not forget about when we, you know, think about all those issues and the pathway to hopefully not so shameful future for our generation. Over to you, Gordon.
Thank you so much for your honesty and frankness at the same time, Inwo. We understand you the counterpoint to Richard's optimism. Both of you are actually realists, and we understand in your current context, surrounded by the fires, that it is that you feel the weight of that. But in your intervention, you have raised a point that has come up before in the seminar, in the forum. You have spoken about the need to ask ourselves, to be self-critical, to ask ourselves, why is it failing? To look at ourselves from the outside, if only to get ideas on how we can improve our own work or our own organizations. And in previous webinars in this short series, we have had words like using evaluation to fail better. Because very often in innovations, because we are well-meaning, well-intentioned, we give ourselves a positive outcome and a positive rating. Everything is headed in the benefit towards the benefit of the population, when indeed there are side effects, unintentional effects, and that we need to take into account in all of this. Questions are coming in, and after our next speaker, I'll do a round of discussion with the four presenters. But I need to immediately now introduce Ilona Kickbush, and I don't know what title to give you, Ilona. I think I'll just call you Tinker. Yes, formally, you are listed as founder and chair of the Global Health Center of the Graduate Institute in Geneva. But ever since I have known you, you have been the coiner of not only new terms, but new concepts and new movements in population health. I remember your phrase as far back as 1989, that good planets are hard to find. Today, everyone talks about planetary health and ecological discussions, but yes, at the time, you were leading the new movement of health promotion. I have seen you contribute to the thinking, if not originated, in the area of health literacy. The discussion today on health diplomacy must always refer back to your own seminal thinking. And a lot of the discussion on commercial determinants of health, not least your current writing and discussions on the international health regulations and their future. So even just with this concept of health diplomacy, a deceptively simple concept, but one that is essential in the modern era and echoes the presentation just made by Richard, an era where multilateralism is under threat, but cooperation has never been more urgent. So for someone like you who has identified and seized many opportunities for innovation in your career, what new opportunities do you see on the horizon? What should the next public health generation, the generation of today, be concerned with? Ilona.
Well, I think I've lost some light here. It's still early in the morning, so now you can see me. Yes. Very good day to everyone who is listening, and thank you very much, Gauden, for inviting me to speak also with such an exciting group of colleagues. And I love thinking of you know, our contact that goes back a long way, when we were both working on various parts of the health promotion movement. And it's lovely to be able to touch base again. What I want to do is first speak about a number of key dimensions of innovation, particularly using a little bit the example of the Ottawa Charter and our process of health promotion, and then look forward. And I feel in looking forward, it's less me defining, you know, what are areas of innovation or change for the future, because it's actually the next generations that have begun to define that for us. And we just heard a little bit from Yinuo about maybe some things, you know, we didn't do where we have responsibilities. And at least if we are still active like myself, we have a responsibility to actually support the next generation in the activities they have started. I think the first thing I want to say is that innovation is not just having an idea. It's actually implementing an idea, it's applying it. And any innovation is a process of change. And that is, if you are engaged in a process of change, you're of course engaged in a process of changing a system, and are changing always, usually, whatever you do, even if it's technological change, you are actually changing a social system. And that's what we try to do with the Ottawa Charter. It was the question, you know, how is health situated within the society? Is health even taken seriously by the World Health Organization and its then very, very medical thinking? How is health understood by people? How can one engage in a process that actually tries to understand this and tries to say, where is health actually created? And we started with that very, very simple question. And I think many social innovations start with very simple questions that are on the mind of people. Where is health created? We said it's created where people live, love, work, and play. And when we started that definition, you know, people used to say to us, what's this love business? You know, all this weak stuff. Well, what happened? Remember the Ottawa Charter was adopted in 1986? Remember when the HIV/AIDS movement started? It was all about, you know, who you love, how you engage in sexual activity. So yes, health is created where people live, love, work, and play. And if you look at COVID today, where are the really dangerous areas of infection? It's nightclubs, it's going skiing, it's where people play. It's not just, you know, where children are in a sandbox. So I think innovation in health has to relate to the challenges people feel and face in everyday life. And that's why we defined health promotion as a process, which is, we were heavily criticized for that. But we established, remember I said, it's implementing an idea and applying it. We searched for partners to implement and apply that. And we called that the settings approach. And as you remember, that was healthy cities, healthy schools, trying to create interactive processes for health that brought many, many actors together and were truly a move towards social innovation. Some smaller points I just want to raise before I sort of go to the outlook. One is we were insistent that we need to be interdisciplinary. We worked with many, many disciplines. And I think even to this day, we have not yet learned that in global health and in public health. If you look at, you know, the Ebola crises and sort of as an afterthought, we involved anthropologists. If you look at the COVID-19 and now as an afterthought, we're pulling in social scientists and economists and behavioral scientists, etc. It just shows, you know, we cannot address health problems without the social sciences, and we cannot address issues around multilateralism without the colleagues from international relations. And we have to also include what often is not accepted in public health, and that is theoretical thinking. Social scientists try to understand society. And all through my life, the guiding post has been a quote by Kurt Lewin, who said, "There is nothing more practical than a good theory. You need to know why you are doing things. You need to have some deep thinking." And maybe finally, the point to keep in mind is if you're really into innovation, implementing it, doing social change, then innovation is risky. You have to take risks. It requires determination. It requires insistence. I've always worked with a quote from a feminist author, Adrienne Rich, who says, "A wild patience has taken me this far." That is, you know, you want to change, but within the change and the pressure for change, you have to understand that change takes time. You know, there's all that research on the innovation waves, etc., etc. We have to take that into account. Now, moving forward, I think one of the key things we learned with the Ottawa Charter was you have to include social movements. We included ecologists, we included the first AIDS activists, we included the women's health movement, etc. And actually the Ottawa Charter was the very first WHO document that referred to ecological change. And it's taken us a lot of wild patience to move forward. But the issue is also, why do we need to include social movements? It's because they ask the question of power. And you cannot have social change without asking the question of power. You need a sense of purpose, and sometimes you need a sense of outrage. And I think Richard also referred to outrage. Sometimes you cannot affect change without outrage and that social force. So as I said, I think the world is full of social innovation. It's full of movements. Many young public health professionals are part of them. And we need to see how we create that interaction with the ecological movement and planetary health, with the new equity and critical justice movement. Remember, there's a big movement out there that speaks about the decolonization of global health, that's addressing power in the health systems, that's looking in the context of COVID-19 at racism, at structural inequalities, very, very important issues for health. There's movements around the digital transformation, trying to understand the ethical and power challenges, facing up to Facebook, if I can call it that, the digital welfare state. And again, there's important social science here. Think of Susanna Zuboff's work on social surveillance, for example. We need to be aware of these things. And finally, we need to think about well-being in the 21st century, the well-being economy, questioning GDP, circular economies, and those kinds of ideas. You mentioned the commercial determinants of health. When we wrote the Ottawa Charter, we were still under the influence of the new economic order. That all disappeared with neoliberalism. Now we need to think again of a much more ecological economy that puts people's well-being right up front. So I think we end up where Richard started. It's global solidarity, it's people and planet, it's we the people. We have to rethink multilateralism in a new way, in an interactive way, and I'm very happy to see WHO reach out much more to people, not only professional and states. And as a final sentence, I love innovation. I've been doing innovation all my life, but let's not get hung up on innovation. Let's not forget the basics. And I think COVID has shown us we need to get back to the basics, addressing social determinants, addressing old and new inequalities. And unless we do that, we're not going to get anywhere. And that's our key political choice. Thank you, Gauda.
Thank you so much. Between the four of you, but no least in your listing, Ilona, we have a full agenda for innovation globally, but a great one to think of as Wipro moves forward. And one of the things I like about the four presentations is the fact that you give us a portfolio of action. It's very easy in the field of innovation to be thinking of a particular solution, one thing that needs to be done, an idea that needs to be evaluated and then eventually implemented and then scaled up. But in reality, as we also will discuss later in this session, we need to provide the policymakers with a range of policy options. We need to open up rather than close. I love those phrases. I would allow me to repeat them again. I've heard it first from you, so it's as much yours as the original authors, but nothing is more practical than a good theory. I do think the question why has been part of the discussion throughout this forum and must be part of the innovation strategy that we take forward. Expecting pushback, using sectors and settings as partners in order to overcome the pushback to our processes of change as we take them forward. And this long list of issues from equity via digital transformation to the well-being economy to the commercial determinants of health, they serve as a very good agenda to keep in mind. I would like to take a moment now, before we go into questions and answers, where a couple are there. I would like to take a moment, given that we have the regional director, Dr. Kasai, to try and get everyone to please switch on their, it's a tradition now on webinars, to switch on your videos and to smile at the camera for a short while, for us to allow us to take a picture of the participants. I hand over to Jen and Vladimir and the technical team to tell us when we can resume our discussion and stop smiling. No, joking. All set? If a technical voice came online and just indicated, please.
Yes, we can resume, doctor.
Okay, so we'll have a short round of questions to our guests and panelists. I'll start with you, Samira. You spoke about health data gaps. There's been some discussion on how do we fill such gaps. Over to you. Do you have any suggestions? A very practical question, if I may start with that. You're muted, Samira. Sorry, I should have told you earlier.
I'm unmuted. Thank you. Thanks for this question. It is an important one. I would like to begin by saying that data is a lifeline of public health, but too much is unknown, too much is incorrect, and there is too much delay in getting life and death information. We are only 9.5 years away from SDGs. WHO established the 3 billion targets derived from SDGs. The pandemic has set us back. We were already not on track, but we have perhaps been derailed in a number of SDGs. Without data, we will not know whether we are making progress, but data is so important to overcome the roadblocks and do it in a real time so we can accelerate. One point I would like to make is we shouldn't be worried about fixing data gaps for the next 9.5 years. We should fix the data gaps now and focus on using the data systems to make progress in terms of policies and programs, whether it is universal health coverage, emergencies, or the health determinants. The response to this problem is WHO, at the request of member states, have begun bringing all the data into one place called the World Health Data Hub, so that member states and countries and our partners and public could have the data as real-time as possible. And we are deriving experiences from our sister agency, World Meteorological Organization. When it was created in 1940s, they had the vision to make data available publicly. Weather forecast. We should be taking lessons and making data available so we could do predictions. We could be better prepared. It can be done. So this is the concept of World Health Data Hub, and we have begun prototyping. The first is on the website. You will see the 3 billion target data dashboards, pooling in all the information, and it will continue. We are looking for partners and resources to bring that very quickly. What do we do to support countries in terms of strengthening their capacity in a sustained manner so that data collection is not just the job of multilateral or donor agencies? We must strengthen the capacities in the country. So with that is every country collects through census every 10 years, we count people. We should be counting the health status of those people as well. If we have standard core of the core indicators that need to be collected, let us give the bread maker to make the bread and candlestick maker to make the candle. Ministries of health could use the data to drive policy, but the partnerships in countries with the ministries of interior, national statistical organizations or census bureaus that are formally responsible to report on SDGs, that partnership is going to be critical. We provide what the standards and what data we would like to have, and this becomes a routine way of data collection in countries. The other part is Ministry of Justice. Like Ministry of Finance that WHO and other partners are working with, but Ministry of Justice becomes very important. There are hidden 1 billion. These are the billion who don't have birth registration, death certificates, and they are not counted because they are invisible. We need death reporting, and it has become a very important now, and also why people are dying. And that is the relationship between the ministries of health and justice to get the deaths right and causes of death right, so that the investments, the financing can be targeted in the areas that are most needed. And finally, behind every number is a person, a malnourished child, a nurse, a father who has succumbed to COVID or any other condition that was preventable. That should not be forgotten, and averages are not enough. because we are missing the most vulnerable. We need data that is disaggregated by sex, by ethnicity, and many other nuanced indicators. We don't have that at the global level. We really need to get granular. Priorities should be in strengthen health systems, health information systems, use today's technology to capture data, to disseminate data, as well as partnerships. We cannot do this alone. We require partnerships at all levels. With that, pass it over to you. Thank you.
I have to say, I did not expect the Ministry of Justice to be part of the answer to filling health data gaps. And I love the laterality of that answer, including one comment that we have in the chat, adding to Ilona's agenda, the importance, Teng Liao is saying the importance of looking at prison reform as part, and I even more laterally reminded of an earlier discussion we had in this conference about the importance of a unique population identifier as a basis for health systems. But so much to say. There's a question for Richard and Inmo about whether you're pessimistic or optimistic. How do we accelerate learning? What are your ideas? There's an innovation is constantly coming up against this phrase of accelerating learning. What can be done about it, especially in the context of COVID, where we need to be, we were not ready. Are we going to be more ready the next time round? So either of you to start. Richard?
First. You want me to go first?
Go ahead.
Boy, you really want to accelerate learning even faster than we've been going the last 8 months. I feel like I want to slow down. I don't want to accelerate anymore. I mean, I can tell you from the, I mean, we're not on the front lines of the response, but in one small little front line, in terms of knowledge creation, it's been madness. Since middle of January, we've done nothing but, you know, I mean, everything's been about COVID. We've been working 100% of the time. It feels like every day, long hours, trying to push through new research, trying to decide on what's important, what isn't important, across all of the journals at the Lancet. We've got 20 odd journals, different specialties. I mean, I think actually what I want to do is I want to pause, not accelerate. I want to pause and reflect on what we've done, because there's been this vast outpouring of knowledge in the last 8 months, but we haven't had a moment to think about what it means. And I'm really seriously trying to slow down. I'm trying to find gaps where I can actually sit and think, okay, what does the last 8 months actually mean in terms of what we do in the clinic, what we do for the health system, what we do for the research system, what we do for public health systems. And we're not seeing that at the moment. Nobody seems to be able to find that space. Certainly political leaders can't, because they're dealing with crises on a 24/7 clock. So I think it's really important that we do that. Now, who's responsible for doing that? I think that's something that is very, very nationally specific. Why did Germany have a different outcome in terms of mortality compared with the United Kingdom? We had the same access to the information at the same time, but Germany's response was notably better than our response in terms of deaths. We need to understand why that was. We speculate, decentralized government, centralized and larger expanded laboratory services. Then I'm sure, good reasons. So at a regional level, I think we might do that better than the global level. And I think that's where, again, WHO regional offices could play a very important role. And we're beginning to see that. You're doing that, Gowden, with this meeting. I know that Hans Kluger's been doing that in the European region. I was on something yesterday with Shidi Moeti. She's been doing that with the African region. I think there are regional specific learnings that we could do. But we have to pause. That would be my message. We have to stop and think.
The stillness among the high winds, seek the moment of reflection and contemplation, and let's be zen about it. Yes, I think, was it Einstein who said if there's if the world is going to end in 60 minutes, I will spend 50 minutes analyzing the situation. So I misquote, I am sure, but I think it reflects a bit your pause question. To Inwo, your own reflection on this, and then I will give the last word to Ilona. Your point about the index has also been requested. So in Kazala's question to the panelists. So Inwo first, and then Ilona, and we round off this session.
Yeah, no, I think, thank you for the question about being pessimistic and optimistic. I think if we're talking about choice, of course the choice is being optimistic, because you don't need to make a choice to be pessimistic. I think it's almost the default stage, to feel overwhelmed. I guess when I was making that point, it was more for us to realize the magnitude of the challenge. Because if we don't have that recognition, we might not, the optimism might be empty. So that was really why. And I think, to respond to this overflow of information, I think it's probably also Einstein said, right? So we have two sides of our brain, the rational mind and the intuitive mind. So I think, oftentimes actually our intuitive mind is more powerful. I think that's where, the broader definition of health comes from as well. The thing about love and play, rather than, like clinical and hospitals as we see it, the hard science. So I think that's probably what's needed, that we collectively draw on, both the rational side and the intuitive side collectively, right, to get to the right solution. So we actually look at the nature of the issue as it is, rather than as a pure scientific problem. I think that was really the magnitude of challenges confronting us, because it's not something we can simply solve by science. The science isn't that complicated. But it's really all this unpreparedness we have as how we organize ourselves, how we respond to a fearful situation that actually drive a lot of irrational behavior, right? So how do we actually see that, and from that point of view, reorganize ourselves in better responding to that? I think, again, Gordon's effort is one step in doing that already. So that's I think that's really the combination we probably need.
Thank you, but to all, it's not my effort. This is the regional project, but this session. Yeah, but thank you for the compliment, Ilona.
Thank you, Gowden. You asked me to respond to the question about the Global Health Security Index, and I think it actually leads us to some thinking that relates to the whole session. Yunua just spoke about how we organize ourselves. And the Global Health Security Index basically went to the issue in a very, let me say, technocratic manner. Do these institutions exist? How much money do they have? How much staff do they have, etc.? But it didn't really reflect, on the one hand, their interaction and their modes of decision making, how quick, how slow, etc. How ready are they really? What mechanisms do they have in place to respond to a crisis quickly? What is the interface of science and policy making? Would they already have, if it's an outbreak where one doesn't know the virus or doesn't know enough about the virus, would they have mechanisms in place? What about information flows? What about the health literacy level of the population? There are so many other issues that one needs to factor in. But of course, if you look at the two countries that were right on top, and that is the United States and the United Kingdom, what made the difference there was political decision making. And that was either decisions that hampered progress on the pandemic, or it was non-decisions. And I think, you know, that difficulty for public health people to actually, on the one hand, be the best professionals possible, push for the best organizations and institutions possible, but being dependent on the political choices that are made by high-level decision makers, and in this case, in both cases, by the heads of government. And I think that is something we have not yet learned to factor in. And I think if we go back to Dr. Tedros with his call to health is a political choice, I think this is what COVID-19 has shown us. COVID-19 has shown us in the greatest of clarity that health is a political choice. And if countries do not make those choices, people die, full stop. And those choices don't only relate to the health system, they also relate to the social protection system. And that's why I'd like to end with a quote from our Global Preparedness Monitoring Report that says, there can be no health security without social security. Unless we address the deep structural inequalities in our society, no matter what health issue we face, we will not resolve it, and the poorer people and the disadvantaged people will be the first to die, and those that have to live with disease the longest. So I think our social responsibility and our political choices are so critical here, and no simplistic index is going to be able to cover them. Thank you, Gavin.
Thank you. And that brings us not only to a good conclusion, but a nice way of wrapping it all and tying about around the package, because indeed, if health is a political choice, then innovation is happening in a very definite policy and political context. And it's useless for us being completely technological about it and thinking that we have some sort of reductionist way of achieving innovation as a process. If there was a way of inviting a wide round of applause at this stage, I would do so. I know that there are electronic means, but can I just tell you that if you saw me being distracted, it's all these notifications coming in and saying, oh, how good these speakers are. So please accept that report as being the gratitude of all of us around, gathered around, both on Zoom as well as on YouTube. Thank you for your wisdom, your philosophy, and your agenda. We will incorporate that in our report. We will move on to another section. You're free to stay, but given the ungodly hour, we will also understand if you have to slip away. So
thank you, Gavin.
Thank you to all.
Thanks, fellow panelists.
Thank you, the regional director and all gathered around here. Thank you so much.
Thank you.
For the next block of discussions, we invite people in virtual presence. And the first one to draw in is Seth Barkley, CEO of Gavi and Vaccine Alliance, who has, if there is one innovation that we are all interested and waiting for, it's the vaccine, as much as the system that will deliver it and help us at least to add another tool to the basic ones that we already have. So to the team, please play the video at will.
Honorable ministers, distinguished guests, and colleagues, I'm sorry I'm unable to join you live, but I want to thank my colleague at WHO for the opportunity to contribute to this important event for the region, and thank Gowden for his leadership. Innovation is at the heart of the Gavi model. From pioneering new financing instruments, developing market-based approaches to stimulate innovation in vaccines, to creating scalable partnerships with the private sector, Gavi has led the way in innovation for global health. And right now, the ability of Gavi and countries to innovate, to devise, implement, and scale new services, products, and approaches that increase the efficiency and efficacy of immunization services is critical to meeting the challenges of this pandemic, but also minimizing the disruption to routine immunization. The global COVID-19 pandemic has already caused the loss of hundreds of thousands of lives and distributed the lives of billions more, wreaking havoc on communities, cities, jobs, and daily life. Impacts on local and national economies as well as international trade and travel continues to result in a loss of about $500 billion to the global economy each month. Developing vaccines against COVID-19 is the most pressing challenges of our time. Protection via safe and effective vaccines is the only viable solution, but it will not work if only a few economies have access to such vaccines. Global equitable access to vaccines, particularly protecting healthcare workers and those most at risk all around the world, is the primary way to mitigate the impacts we're all experiencing and to get past the acute stage and working towards bringing the pandemic under control. As CEO of Gavi, I, along with my colleagues at WHO and the Coalition for Epidemic Preparedness Innovation, CEPI, are driving a global coordinated and financing effort that will accelerate the deployment of COVID-19 vaccines across the world, the COVAX facility. The facility aims to provide the world with the best chance that safe, efficacious COVID-19 vaccines are rapidly available and affordable to the highest risk populations worldwide, regardless of their income level. It is the only global effort of its kind. The facility aims to provide at least 2 billion doses of a workable vaccine by the end of 2021, enabling participating economies to protect frontline health care and social workers, as well as other high-risk groups as identified by the WHO. The COVAX facility, if successful, will be a testament to how global organizations come together to devise a new model of working. However, as we think about the COVID vaccine, we are also presented with the need to re-examine existing immunization systems and processes to explore how to strengthen these where needed, and perhaps this can be the silver lining of this pandemic. For instance, Gavi is currently evaluating how COVID-19 vaccines will need to be delivered. Having the right data to make effective decisions will be critical. Often the problem is not the absence of data, but the inability to make sense of it all. The ability to triangulate data from different sources and build a holistic picture of what is happening on the ground is needed, especially when dealing with a novel vaccine, which will require accurate information for its effective distribution. Solving a systematic challenge such as this does require integrating and adapting new approaches and mobilizing additional resources. Gavi has a history of partnering with the private sector in solving these types of complex problems. For instance, Gavi brought together the financial resources of Tencent and the capabilities of Zenesis Technologies, a platform that solves for the data fragmentation challenges using advanced machine learning. We are partnering with Zenesis to continue to support countries with the COVID-19 response by quickly establishing data control rooms which enable decision makers to understand where additional support will need to be provided. Another area that Gavi is focusing on is being able to identify who receives a vaccine. Approximately 1.1 billion people lack any form of formal identification, And without a record, it makes vaccinating vulnerable populations, often those missed from immunization programs today, hard. Often some of these populations are highly mobile and nomadic or stigmatized, making it hard to keep track of who has been and who is yet to be vaccinated. And this is exacerbated for newborn infants and children whose identification is challenging. To solve for this, Gavi is pulling together biometrics partner Simprints and the Japanese electronics giant NEC to develop a robust biomedical technology that can capture newborn fingerprints and allow vaccine health workers to identify and re-identify children wherever they may be. With strict consideration to privacy, this approach will help us ensure that children receive all their immunizations. Both Simprints and Zenesis are organizations coming out of Gavi's Infuse program, our accelerator program that we deploy to source highly promising innovations and then partner them with the private sector to support their scale, in this case NEC and Tencent. However, we know that within the region there is considerable innovation yet to be tapped and private sector resources, expertise, and technology to be leveraged. The depth and scale of the challenges that lay ahead of us in addressing COVID-19 and minimizing disruption to routine immunization will require us all to work together. And therefore, I applaud WHO for driving the first ever innovation forum in the Western Pacific region at this time, and commit to working with our partners and you in addressing these challenges in front of us. Thank you very much, and good luck for a excellent meeting.
So thank you, Seth. We have two other brief interventions from our colleagues at UNDP, where Giulio Quaggiotto, who is the head of the Regional Innovation Center, will speak, and also Louise Ayersnap from WHO Geneva, who heads the innovation program there. So if we could, and with her, we have had a small interview together with Vladimir Choi, part of our innovation team in Manila. If you could play them in sequence, please.
My name is Giulio. I am the head of a new innovation unit, a strategic innovation unit created at UNDP. The story of UNDP's journey is one of increasingly realizing and acknowledging that we're dealing with complex development issues, and the tools that we have at our disposal to deal with those were really designed for a different set of issues, more simple or more linear. So I wanted to share with you just 3 quick insights on this. The first one is, if you're dealing with complex issues, you really cannot rely on single point solutions. And this, unfortunately, has been often our mistake in the past. There is no way of fixing deep entrenched poverty issue with a design thinking workshop. There is no way of solving environmental issue with a blockchain solution, just like you cannot solve COVID with a contact tracing app. So if you cannot rely on single point solutions, then you look at a different logic. You need to understand much more the deep dynamics of systems. You need to appreciate that the only way you understand really a complex system when you start to interact with it. And then you need to inform your intervention logic based on what we call portfolio approaches. So the ability to actually act on many leverage points in the system at the same time, so that you're actually accelerating your learning as the system changes, and then maximize their chances of having an impact. This is what we are currently doing, for example, in this region when it comes to issues related to waste or the future of work, and increasingly also in our COVID response. The second consequence of accepting that you're dealing with complex issues is that you need to recognize, at least this has been our own experience, But the logic, but what happens is that when you get to a point when you get a decision maker or our own project managers or the community, that we're dealing with things that are deeply systemic, interrelated, that have to do with power imbalances, that have to do with a multitude of factors coming together. In this, when you realize that often the feeling is one of disempowerment and loss of agency. Or if you think about climate and the sense of despair that often comes when thinking about something as complex as that, how do we preserve a sense of agency for policymakers, for communities, for development practitioners? We're dealing with this type of issues. When you're dealing with complex issues, the last thing you want to do is to reduce your options and put all your eggs into magic unicorns that by miracle scales after having tried 10,000 little different things. We rather think about it as a logic of aggregation. So you intervene in a system, you intervene in a complex challenge, and you try over time to aggregate the impact of your actions so that you actually provide policymakers with more options, not less options, when have to deal with such a complex task. And the third thing that we learned is that no matter how much there is an appeal in the innovation space for speed, speed is not a direction. So if you look, for example, at the COVID response, questions that we need to ask are not only about the quick fix. Of course, these are fundamentally important in a condition of emergency, but we also need to think, are the solutions that we're putting in place actually reinforcing logics that put us into a situation in the first place? And unfortunately, because there's often a mystique around innovation, these questions around what are we trying to do? What is the overall direction? Are we putting in place solutions that empower people and communities over time, or are we actually locking them up into unsustainable paths? Is the technologies, for example, that we are adopting, are they actually fixing the problem, or are opening up a new Pandora box in terms of surveillance or maybe environmental impact over time? Is the behavioral science intervention we are promoting actually allowing people to take more informed choice, or is yet another way to reducing their options and perpetuating power imbalances? These questions of overall direction, of public purpose and public value, we've learned ourselves to ask more and more as we move forward in our innovation journey. Ultimately, what all this means is that we learned that we really need to readjust our organization for a different type of logic. At the moment, most of our systems and our activities are designed for delivery and accountability. And of course, we need to absolutely maintain this for transparency purposes. But in the face of complex issues, we also need equally to design our organization for accelerating learning. And this is quite a different logic. This is beginning asking questions around the logic of our interventions, how these produce not only effects and outputs, but how they deliver intelligence that we can actually use to inform better decision-making over time. Thank you very much again, and I hope you'll have an excellent event.
Hello, I'm Vladimir Choi, focal point for innovation at the WHO Regional Office for the Western Pacific in Manila. I'm pleased to be joined by Louise Auersnap, who is the head of the Innovation Unit at the WHO Department for Digital Health and Innovation, based at headquarters in Geneva. Thanks for joining us, Louise.
Thank you. It's a pleasure to be here.
So innovation is a term that is increasingly discussed in the realm of global health. How is it being interpreted by WHO? And what are some of the concrete steps that WHO is taking globally to meet the yearning of member states for increased engagement and support on innovation?
Well, WHO's strategy, the 13th General Program of Work, actually makes a strong case for innovation as a key enabler of achieving the impact we want to achieve in the Sustainable Development Goals and in WHO's triple billion goals. And we are currently building a WHO innovation strategy on that basis, and we're doing this in close consultation with internal and external stakeholders. The way we approach innovation in that regard is that we see innovation as indispensable if we want to achieve our goals. And if leveraged smartly and guided by the right values and purpose, and also driven by needs, then innovation can become that force for good that enables us to ensure the equitable distribution of healthcare resources. So the definition that we're taking to innovation is quite broad. It encompasses process innovation, social innovation, products, and digital innovations.
Thanks, Louise. Could you tell us a bit more about this strategy?
Sure. The strategy is centered around 3 strategic objectives. The first one is about fostering a culture of innovation in WHO and in member states. The second one is about aligning with our partners around a common purpose of making innovation exactly that force for good for health. And the third strategic objective is about scaling for impact. And we are seeking to achieve these objectives through 3 functions that we call the hub, the incubator, and the accelerator.
Could you speak to some of the results that you're anticipating?
Sure. So as we're finalizing the strategy, we're actually beginning to already test some of the key elements and beginning to see great results from that. Firstly, we launched an external innovation challenge called Reboot Health and Wellbeing, from which we identified 2 social innovations as winners, and we're right now supporting them in their scale-up process. Secondly, as an innovation in itself, we're setting up what we call the WHO scaling platform, which seeks to leverage the comparative advantages of WHO, our partners in countries, the innovation funders, WHO's technical assessment capacity, and so forth. So it's really trying to bring economies of scale and speed to scaling, which we know is one of the most challenging parts of innovation, but perhaps also the most important, given that that's where you can get bigger impact. Thirdly, we're currently setting up a physical innovation space called Eureka at WHO's headquarters, which will be a space for WHO staff, member states, and partners to co-create and innovate together. We've also launched an internal innovation challenge platform called LEAD, and this is a key driver of the culture change in WHO right now to foster this culture of innovation that I spoke about earlier. Lastly, we are also setting up a strategic advisory group on innovation, and hope that this will be a hub of multidisciplinary range of experts that can help us as we implement our innovation work across regions. And lastly, I just want to mention on the scaling platform that we're actually currently testing this in the context of COVID-19 in the area of medical oxygen innovations.
Thanks for discussing everything that WHO has been working on and will be embarking on as well. So I just wanted to touch a bit more on COVID-19. As every participant is aware, it has unleashed a massive wave of innovation worldwide. How do you see COVID-19 impacting the way innovation is cultivated and disseminated? In other words, do you think COVID-19 will lead to a renewed focus on innovation to achieve health for all, or will it simply widen the existing innovation gap?
Mm-hmm. Well, indeed, since the onset of the pandemic, we have seen a huge surge in innovation globally. However, as WHO and part of the United Nations, we have a key role to play in working with countries and partners to ensure that the innovation supply is actually addressing the needs of people and the people that we serve, and that innovations are indeed helping us address gaps and not widen them. And on that, I think the verdict is still out.
Thanks. So, in this innovation forum, we are joined by representatives of numerous member states from around the Western Pacific region. What would be your advice to them going forward as WHO formally embarks on its innovation initiatives?
Well, we're here to support our member states and help them turn innovation into impact for the people that we serve. So rather than advise, I'd just like to encourage member states to join us all across WHO's regions on this journey as we try to leverage innovations to deliver on our common goals. And in closing, I'd like to emphasize two important aspects of innovation to keep in mind in that regard. First of all, let's put needs at the center of innovation. And secondly, let's focus on our collaboration on scaling innovations for greater impact. And if I may just lastly say that we hope that this WHO innovation strategy will be a helpful and meaningful framework for all of us as we go along, and that we look forward to feedback and working with everyone and adjusting the strategy as we learn. Thank you.
It's certainly good to hear that WHO in Geneva and in the Western Pacific are taking a harmonized approach to innovation. Thanks for sharing your insights with us, Louise.
Thanks for having me, and I wish you an excellent innovation forum.
So thank you to the technical team over there. We are now a few minutes over time, and I will skip my final concluding remarks. I think enough of the key words have been spoken and shared. There are two slides that I would like to come up and then hand over to the RD for his closing speech. I know that the team is setting them up. And as has been the tradition, we thank our illustrators who have been working hard in the background to try and capture in a visual form the key messages. Thank you so much for your contribution. And alongside them, our rapporteur, Alex Matheson, who has been quietly, his product will be seen later when we produce the report. So much to say on this slide, but I will just leave it as a visual memory and pass on to the next one. Basically, it would be impossible, despite the fact that this was not an in-person meeting. There have been a remarkable number of people who have contributed to making this a success. There is absolutely Gundo, who is now in Copenhagen, and also the Director of Data Strategy and Innovation. He's straddling his transition, has been the co-organizer, and these teams in Manila and the WHO China office have been working very hard to ensure everyone got their Zoom links, etc. on time. So Vladimir, Jen, Mongji, Baisa, and Louis. And I will not read all the rest. Please allow me to thank all the moderators, the participants, the interactors, the discussants who have been there at every session. You've all worked very hard, but our biggest thanks has to go to Dr. Takeshi Kasai, the regional director, who has not only had the idea of organizing the forum, but has been the driver behind the forum itself and the operational shift. For everyone's patience due to our overrun, I hand over to Dr. Kasai. Thank you very much.
Thank you, Gordon. Good afternoon, good evening, and I also noted that good morning to those all connected to this forum. And thank you all for joining these final sessions of the Innovation Forum and all of the sessions over the last few days. I think my colleague, when we started this session, she said that behind the mask, I'm smiling. I'm saying the same things. What a great few days it has been. I myself alone really learned a lot. And I hope that was the case for all those who've been connected. we have had a very interesting and diverse, thought-provoking series of discussions. I'm very happy to see how much people are actually interested in this topic, and also happy to hear that the people think we are actually going into the right direction. As I said on Tuesday, the topic of innovation is very broad. On one hand, we had some very interesting presentation and discussion on technology and system innovation. And for example, how this can be applied in aged care. But on the other hand, I heard on the topic like caring of the elderly, it is important to acknowledge that even the cleverest technology cannot replace the need for human-to-human interactions and warmth. I heard people are using a different language, but I noted that everybody see that there will be an ongoing need to sharpen our judgment about what are the right innovation for both individual and society more broadly. I can clearly see this is one of the challenges that we have to develop this kind of mechanism. And of course, innovation is not just about solving the problem of today. Today is the result of yesterday. It is about how we tackle the challenge of the future. Our region is so diverse, stretched from the Mongolia and China in the north, and then the Australia, New Zealand in the south, and then the French Polynesia to the east, and again, China to the west. We're home to the world's largest country, as well as some of the world's smallest countries. And our region is also incredibly dynamic. The countries are keep changing, dynamically developing. But what I have seen in the countries in common is that every member state in this region has a very strong interest in working for the future and how we address future challenges. And obviously, the innovation is central to this. We are committed, and we're going to commit also for the future to ensuring that innovation will continue to be the priority for WHO in our region. And let me conclude by thanking all of our excellent speakers and panelists, as well as all of the participants who have joined the forum online over the last few days. We really appreciate your interest and value your participations. We took all the notes and then we'll discuss among ourselves, together with, again, yourself, with the member states, how we can actually translate those discussions into action. Finally, I wanted to thank Gundo, Gordon. This meeting itself, we organized in a little bit innovative way. We found that among our country representatives, very capable and also very interested in innovations, Gordon, who sits in China, and then our director, Gundo, works together in organizing this excellent forum. So thank you very much for you two, and the team who works with you too. Finally, this is not the end of the conversation, but rather it's a start of the long journey and towards making the Western Pacific the healthiest and safest region. And as I already mentioned, that all those who connected in the past 3 days, I hope we can make this journey together. WHO alone cannot make things happen, but together with all of you who are connected, I think we can make a very interesting journey to see our region one of the healthiest and safest in the future. So thank you very much for all those connected. And again, behind this mask, I'm very much smiling. So really, thank you very much.
Thank you, Ardi. Thank you so much. Bye.